this is an iHeart podcast. Guaranteed human.
Amazon Health AI presents Painful Thoughts.
Why did I search the internet for answers to my cold sore problem? Now I'm stuck down a rabbit hole filled with images of alarmingly graphic sores in various stages of ooze. I can clear my search history, but I can never unsee that.
Don't go down the rabbit hole. Amazon Health AI gets you the right care, fast. Healthcare just got less painful.
The Joel Osteen Daily Podcast.
God's plans for you are for good.
Be inspired.
Get ready. God is about to exceed your expectations.
Joel Osteen Daily Podcast.
You are coming out of that dry place into more than enough.
Daily encouragement right when you need it.
There are opportunities in your future bigger than you can imagine.
Listen to the Joel Osteen Daily Podcast on the iHeartRadio app, Apple Podcasts, or wherever you get your favorite podcasts.
This is Red Pilled America. The revelations of Dr. Fauci's diary have us all angry, reliving the lunacy of the COVID shutdowns. We must never forget how COVID brought a taste of communism into America. While we're working on new episodes this week, we'll be playing a few episodes from the COVID era that we haven't replayed in years, including this one titled Pharmageddon, which was originally broadcast on October 1st, 2021, at a time when shows were being deplatformed for stories like this. And if you want to get Red Pilled America ad-free, go to redpilledamerica.com and click Join in the top of the menu. Now on with the show. It's hard to argue with the fact that COVID has brought us closer to communism. Just a few years ago, a communist America sounded preposterous, but it doesn't sound so crazy anymore.
If you want to stay unvaccinated, that's your choice. But if you want to travel, you better go get that vaccine.
And today we're bringing it to 100% of the workforce must stay home.
Proof of COVID-19 vaccination will be required at bars, nightclubs, and more in Los Angeles County.
My message to unvaccinated Americans is this: what more is there to wait for? We've been patient, but our patience is wearing thin.
As big government expands its reach in the wake of the COVID outbreak, what has the virus taught us about communism? I'm Patrick Corelchi.
And I'm Adriana Cortez.
And this is Red Pilled America, a storytelling show.
This is not another talk show covering the day's news. We're all about telling stories.
Stories Hollywood doesn't want you to hear.
Stories the media mocks. Stories about everyday Americans that the globalists ignore.
You can think of Red Pilled America as audio documentaries, and we promise only one thing: the truth. Welcome to Red Pilled America. There's no denying it. COVID has given America a taste of communism. We feel it in everyday life. Shutdowns, mask mandates, government-run healthcare, cancel culture, censorship, vaccine mandates, vaccine passports, proposed interstate travel bans, government-forced bankruptcies, rent moratoriums. The list goes on and on. As big government expands its reach in the wake of the COVID outbreak, what has the virus taught us about communism? To find the answer, we talked to Dr. Pierre Kory, a critical care expert who's been on the front lines of the COVID fight from day one. We also hear from Tyler Boyer, COO of student organizing powerhouse Turning Point USA. The COVID crisis has touched these two men in very different ways, but what they've learned teaches us a lot about the essence of communism.
It was April 2021, and reports hit the Western world that India was entering a massive crisis.
Tonight, what officials in India call a tsunami of coronavirus cases is fast becoming a global catastrophe. For the third day in a row, the country's shattering world records. More than 345,000 cases reported in the last 24 hours. Nearly 1 million in the last 3 days alone.
India's Supreme Court says the country is facing a national emergency as its healthcare system buckles under a second wave of coronavirus patients.
The front line, an emergency room in a COVID hospital, just about standing under the weight of an unfolding disaster. A patient who's hardly breathing is brought in.
This desperate young woman crying out, "This hospital is useless." Her mother taken away on a rusty gurney. Stricken hospitals pleading with the federal government to provide emergency supplies of oxygen after 20 people reportedly died without it in Delhi. The death toll so high, mass cremations are being held in the street.
As April 2021 progressed, the COVID crisis continued to grow with no end in sight.
The latest official figures show around 17 million coronavirus cases have been recorded so far. And for the fifth day in a row, the Indian government has reported more than 300,000 infections, a world record.
What sort of number of infections will there be by the time it peaks?
The numbers of infections at peak are predicted to be somewhere around 500,000 to 900,000 per day. I mean, having a lockdown in cities like Delhi or Bangalore or Mumbai will help, but these events, the election campaigning, the election rallies and the festivals need to stop. Otherwise, we are taking the virus to all parts of the country.
And the virus did spread, but not because of lack of lockdowns. No, it was actually a fear of lockdowns in big metropolitan areas that spread COVID-19 to other parts of the country, including the Indian state of Uttar Pradesh.
Millions of migrant workers returned home to escape lockdowns, and many of them were from Uttar Pradesh and working in other cities. And so they brought this huge influx.
That's Dr. Pierre Corey, president of Frontline COVID-19 Critical Care Alliance, or FLCCC. With a population well over 200 million, Uttar Pradesh is India's largest state. Again, Dr. Pierre Corey.
I think it would be like the 8th largest country in the world if it was a country. It's a very poor state.
Those two factors, a massive population and poverty, made the Indian state extremely vulnerable to an influx of virus-infected citizens. As cases surged by a factor of 4 in the Indian state of Maharashtra, Uttar Pradesh's cases jumped by a factor of 125 in just 1 month. Infections were skyrocketing, so leaders in the Indian state had to do something and do it quickly. They put together over 2,000 government teams, and on May 5th, 2021, they began moving across Uttar Pradesh to nearly 100,000 villages in 75 districts. The World Health Organization, or WHO, accompanied the teams on their first day and monitored their visits of 10,000 households. 2 days later, the WHO published a glowing report of their effort with the featured story on their website entitled, "Uttar Pradesh Going the Last Mile to Stop COVID-19. In the report, the WHO documented what Uttar Pradesh was doing, stating, quote, "Each monitoring team has 2 members who visit homes in villages and remote hamlets to test everyone with symptoms of COVID-19 using rapid antigen test kits. Those who test positive are quickly isolated and given a medicine kit with advice on disease management," end quote. The WHO held up Uttar Pradesh as a shining example of a government that was getting it right. But in their article, the WHO failed to mention what was actually included in the medicine kit the teams were distributing. It was an auto mission. With the crisis raging elsewhere in India, something miraculously happened in Uttar Pradesh. By mid-June 2021, state officials announced that new cases had dropped an astonishing 97.1%. Again, Dr. Pierre Corey.
But the cliff-like decrease in cases and deaths was phenomenal.
Then just 3 months later, in mid-September 2021, the Uttar Pradesh government made another stunning announcement. 34 Uttar Pradesh districts were declared COVID-free, and on the day of their announcement, only 14 new cases were recorded throughout the entire Indian state.
Uttar Pradesh has essentially eradicated COVID from a state of hundreds of millions of people. In the last 186,000 tests that they've done, they've had 21 positive cases, which is 0.01%, which is essentially zero.
How did they do it? Well, the mainstream media tied the success to the COVID-19 vaccine, but that assertion failed the smell test. By the end of May 2021, just as Uttar Pradesh was in the midst of their miraculous recovery, India's most widely circulated magazine reported that Uttar Pradesh had only fully vaccinated 1.67% of its population, almost 3 weeks after the WHO praised the state for its effort attacking the surge. By the time Uttar Pradesh had announced its eradication of COVID, Indian newspaper The Times of India reported that Uttar Pradesh had only fully vaccinated 11% of its population. For comparison, in the same month, the CDC announced that the United States had fully vaccinated 55% of its population, and the U.S. has not even come close to eradicating COVID-19. But Uttar Pradesh's success is even more stunning when you compare it to the Indian state of Kerala. According to India's News 18, by late August 2021, Kerala had fully vaccinated 20% of its population. Yet on August 25th, the Indian state reported 31,445 new cases. In the same time period, Uttar Pradesh, with 7 times the population of Kerala, had fully vaccinated less than 5% of its population. But on the same August 25th day, Uttar Pradesh only clocked in 22 positive COVID cases. In other words, Uttar Pradesh's success could not possibly have been tied to vaccinations. So, what was it? If we're to believe Uttar Pradesh's government's numbers, how was the Indian state able to essentially eradicate COVID-19? Well, along with other therapeutics, the Indian state tied its success to a drug that came into medical use in 1981. Again, Dr. Pierre Kory.
They literally eradicated it through a policy of just widespread and systematic use of ivermectin. And I just have to tell you, I'm one of the world experts. It is literally the penicillin of COVID. If you didn't hear about this before, Patrick, it's by design. That story is not getting picked up. It's all in all the Indian newspapers. It's not a secret. The architects and the health ministers of that state are starting to talk. They're starting to show what they did and what the results are, and you're not hearing about it in this country.
Why has there been a blackout of this stunning success? Well, Dr. Kory's experience on the front lines of what's been called the ivermectin wars goes a long way in providing the answer. His journey shows just how far America has drifted from its core principles. When first word of the coronavirus outbreak hit America, Dr. Kory was in a position of leadership.
I was the chief of the critical care service and the medical director of the Trauma and Life Support Center at the University of Wisconsin. And when we started hearing, about this, little outbreak in Wuhan, I remember being in meetings with high-level leaders who were like, it's not going to come here. This is all overstated.
But then Italy had an outbreak, then a nursing home in Washington State.
911 emergency. Hi, this is Life Care Setting of Kirkland. We have a lady in the lobby that is having chest pain and shortness of breath.
Okay. By the time Seattle got hit, we knew it was coming. And so I spent months as a clinical leader preparing for this disease to come hit us. And remember, I'm a pulmonary and critical care physician. And what broke out in the world? A pandemic of a pulmonary and critical care disease, a severe lung infection. That's what people die from. It's from lung failure. And that's my expertise. So, it was time to rise and just shine here. I wouldn't say it's a calling. I don't want to sound so, egotistical, but I really felt like this is a particular time in my life and history, and that I got to go after this thing.
It took a few weeks for COVID to hit Dr. Kory's town of Madison, Wisconsin.
I saw my first cases in April.
At the time, Dr. Kory was already communicating with his mentor, Dr. Paul E. Merrick, a pulmonary and critical care legend based in Norfolk, Virginia. Dr. Merrick is one of the most cited scientists on the planet. And in critical care and emergency medicine, he is ranked number 2 in the world. The two joined a team of other highly credentialed critical care doctors and formed the Frontline COVID-19 Critical Care Alliance. The team's mission was to develop coronavirus treatment protocols.
So my group formed very quickly. It was put together by Professor Paul Marik. He's famous for his protocols.
Technically speaking, a medical protocol are treatment guidelines for a specific clinical situation based on a patient's symptoms. So outside of his work at the university, Dr. Corey joined Dr. Marik's team to help develop a protocol for COVID patients.
And we just started consuming papers. I was learning everything I could about COVID, and we were calling doctors. We had Zoom calls with Chinese doctors. We had Zoom calls with people from Italy. And I know someone in every ICU in New York City. And so I was on the phone every day.
They were trying to figure out from those on the ground what was and wasn't working.
As a group of experts, we just consumed everything we could about COVID. And all we were focused on is developing effective treatment protocols and evolving with the data.
As the crisis progressed, Dr. Corey began to experience something new in his leadership position at the University of Wisconsin.
This strange thing started to happen where I've never had this happen before. In fact, I've always been free range to treat patients as I saw fit.
But then all of a sudden, there was a shift.
What we were starting to do as the patients started to roll in is we had daily clinical meetings so that we'd have these calls.
Calls with key staff and the hospital leadership.
And I was kind of running the calls. And I would update everyone on the new policy or procedure that we would do with this. I would give some guidance on how to clinically manage.
Dr. Corey was learning from his colleagues on the ground in Detroit, in New York City, and other hard-hit areas that a treatment for the most severe COVID patients was being identified.
One of my mentors, he told me they couldn't get anyone off of a ventilator. They couldn't prevent anyone from going onto a ventilator. Guess what? They started corticosteroids, and he said the entire landscape shifted.
So during his leadership calls at the hospital, he began recommending the use of corticosteroids.
I tried to institute a blood thinning protocol because it was clear they were clotting at degrees I had never seen in my life. I was working with world famous hematologists who all were saying, we need to anticoagulate these patients. We need to thin their blood. But then on these calls, I started to talk about the potential role of blood thinning, the potential role of using corticosteroids. And what was happening is the leadership started to speak up on these calls. And I was basically being drowned out. And my leaders, my superiors, were essentially saying, follow the guidelines, follow the guidelines. All of the academic societies around the world started putting out guidelines. And they weren't really guidelines. They offered nothing.
According to Dr. Corey, there was no consensus on treatment in the guidelines derived by big national and international societies. So his leadership reverted to a treatment process he'd never seen before.
I was being told by people above me that we should do nothing, meaning supportive care only. And supportive care only for viral syndrome just means like fluids if you're dehydrated, oxygen if you need oxygen, Tylenol for fever. You're just treating symptoms and you're giving support. No specific therapies. Normally, the true advances and discoveries happen organically on the ground by those on the front lines. You discover that you do trial and error using risk and benefit, and you find stuff that works. And then you feed it backwards, and then they can design studies to test some of your discoveries and validate them, right? Whereas what happened here is everything became top down. And we got crushed, those of us on the front lines treating this disease, like I just gave you the examples. And suddenly we were being told what to do and what not to do. And I found it just suffocating. And I saw the patients were suffering. Like when you suddenly flip that process, and I don't want to use words like totalitarian, but it became very strict, very oppressive, and very top down. And we're told, no, you can't do it. Like I've never seen this. We got restricted from practicing medicine the way we've practiced since inception. And so I pretty quickly saw that, I refused to stay in a position of leadership when they were literally telling me to dictate the practice of medicine to those under me in a way that I fundamentally disagree with. These patients were dying at rates we'd never seen. I said, clearly we can't work together anymore. And I asked for humanitarian leave to go to New York City because at the time, all of the national critical care societies were sending out emails to all their members. All intensivists come to New York City.
He felt like it was his calling. So he took a leave of absence and went to the epicenter of the crisis.
And I entered a catastrophe. I'll never forget what happened in New York. I ran my old ICU for 5 weeks, and it was indescribable what we were seeing, these poor patients.
But things were about to get even more intense for Dr. Corey because he was about to enter the national spotlight. And what he experienced was life-altering.
I'm a changed man. The things that I've learned, that I've seen, the distortion of science, and I wish I hadn't learned this, but I'll never be the same again.
All right, if you guys know anything about me, you know that I am crazy about my dogs. And let me tell you something. My English Bulldog Pablo had been suffering with the worst skin allergies. And then I started giving him rough greens in his food, and boy, what a difference that made. This stuff is amazing. Now Pablo is a Rough Greens dog for life. Rough Greens supports long-term health by providing live, bioavailable nutrients, including essential vitamins, minerals, probiotics, digestive enzymes, and omega oils. Rough Greens promotes longevity by addressing common nutritional deficiencies found in processed dog food. I don't just recommend Rough Greens, I depend on it to keep my dogs happy and healthy. Traditional dog food is shelf-stable for years because it's lifeless. Rough Greens brings the nutrition back, packed with live vitamins, minerals, probiotics, digestive enzymes, and omega oils. Rough Greens isn't dog food. It's a live nutritional supplement you add to your dog's food. You don't have to change your dog's food to improve your dog's health. Just add a scoop of Rough Greens. It's that easy, and I promise you will not regret it. Don't change your dog's food, just add Rough Greens. Rough Greens is offering a free Jumpstart trial bag. You just cover shipping. Use discount code RPA to claim your free Jumpstart trial bag at roughgreens.com. That's RUFF greens.com, promo code RPA. So don't change your dog's food, just add Rough Greens and watch the health benefits come alive.
Amazon Health AI presents Painful Thoughts.
I can't stop scratching my downtown. Yeah, but I'm not itching to go downtown and tell a receptionist I'm here to talk about my downtown. Some things you'd rather type than say out loud.
There's no question too embarrassing for Amazon Health AI. Chat your symptoms and get virtual care 24/7. Healthcare just got less painful.
The Joel Osteen Daily Podcast.
God's plans for you are for good.
Be inspired.
Get ready. God is about to exceed your expectations.
Joel Osteen Daily Podcast.
You are coming out of that dry place into more than enough.
Daily encouragement right when you need it.
There are opportunities in your future bigger than you can imagine.
Listen to the Joel Osteen Daily Podcast on the iHeartRadio app, Apple Podcasts, or wherever you get your favorite podcasts.
Welcome back to Red Pilled America. So as the coronavirus reached Middle America, Dr. Pierre Corey was the chief of the critical care unit at the University of Wisconsin. He was getting frustrated because the leadership at the hospital was tying his hands, not allowing him to treat COVID patients as he saw fit. So he asked to take a leave of absence and went to New York City. But things were about to get even more intense for the critical care doctor. In May 2020, Dr. Corey caught the eye of Wisconsin Senator Republican Ron Johnson.
He couldn't understand why the NIH and those groups were not putting out a treatment protocol beyond supportive care only. And in his words, he wanted the doctors to take their gloves off.
Senator Johnson had become a big proponent of early treatment. In his research, he saw that the Frontline COVID-19 Critical Care Alliance, or FLCCC, had put out a treatment protocol and that one of the members of the group, Dr. Corey, was from his home state. So the senator asked Dr. Corey to testify before Congress.
Dr. Pierre Corey, I just spoke with him last week, and he's currently on the front lines in New York. And the reason I wanted to put him first is to give us a little bit of hope. What he is talking about in terms of effective therapy once individuals have been hospitalized, I think is very encouraging. And I wanted to give him enough time to kind of speak to that.
And I testified in May 2020 that corticosteroids were critical and life-saving in this disease. And I used a number of reasons for that.
We want to call attention to the world to what we think is a tragic error in analysis of medical data. And that is the fact that all societies from the beginning of COVID have advised against the use of corticosteroids in COVID-19. We think that is a fatal and tragic flaw.
And after that testimony, boy, did I get crushed. The university was not happy with me, but I had actually resigned the morning of that testimony because I had already known I was going to go. And yet they went after me because I went against the entire world. Well, guess what happened, Patrick?
At Oxford University in Britain, researchers say a commonly used anti-inflammatory drug can and has saved the lives of the sickest COVID-19 patients. The drug is dexamethasone, a steroid that cut the death rate by 20% for patients on oxygen and 35% for patients on ventilators.
Dr. Corey was proven right.
Standard of care changed overnight, and that was 7 weeks later. But in those 7 weeks, I was getting roundly criticized and attacked for advocating something that they thought was going to increase mortality.
Through the summer of 2020, Dr. Corey and his colleagues at the FLCCC wrote a paper on their therapy protocol. They also continued to devour the new data that was coming in from all over the world.
Is we constantly reviewing data, and we were looking at all the trials of the different therapeutics that were being used, and they were all negative, meaning they just were not showing benefits of numerous therapeutics.
But one drug started to enter their radar.
We'd always had ivermectin as a question mark. We didn't have it on our protocols, but it had some theoretic rationale.
Ivermectin is a drug discovered in 1975 by a Japanese biochemist named Satoshi Omura.
And it's a substance made by a bacteria, and it is wickedly powerful against parasites.
Satoshi Omura worked with a scientist from the pharmaceutical company Merck to refine it. Merck then began marketing ivermectin as a veterinary antiparasitic in 1981. Its massive success in this application triggered Merck to collaborate with the World Health Organization to test its safety and efficacy in humans.
And they found that it's one of the safest drugs, and they started to use it against parasitic diseases. And they noticed that it could absolutely cure anyone of numerous parasite infestations.
So in 1987, Merck registered ivermectin in France for use in humans.
And what happened is the WHO and Merck actually donated hundreds of millions of doses over decades for WHO public distribution programs. And in a number of continents across the world, it essentially eradicated two of the most terrible parasitic diseases known to man. And for that impact, they won the Nobel Prize because it had one of the most magnificent public health impacts in the history of medicine, right? It rid the world of onchocerciasis, which is known as river blindness. And in Africa, there was communities where half the men at the age of 40 were blind because of this parasite, and they would be led around the village by children with sticks. It was like, that was the thing.
When ivermectin was taken in these African villages, it stopped the parasite in its tracks, saving millions of Africans from going blind. Since its inception, Merck has distributed over 4 billion doses to humans. Ivermectin earned the label Wonder Drug. Because of its overwhelming safety in humans, scientists began investigating if it could impact other diseases.
10 years ago, they started doing basic science studies in the lab against viruses, and it was showing effective in the lab against Zika, dengue, West Nile, HIV, influenza.
And because it was showing antiviral properties, scientists began looking at it for COVID-19 in April 2020, during the peak of the first outbreak.
And then in April, an Australian group did a trial of basic science, like a cell culture model, against SARS-CoV-2, and it obliterated the virus from the cell culture model. And so you had all this basic science data as an antiviral. The problem is, right, a lot of things look good at the bench, but they don't make it to the bedside, right? They fail for safety or concentration or whatever.
So a few doctors around the world began testing it in humans who were at high risk to contracting COVID. By October 2020, some of those trials began to surface.
We just started to see about maybe 3 or 4 or 5 trials pop up from different centers and countries, diverse throughout the world, that were like absurdly positive. And we were really shaken because the consistency and reproducibility around the therapeutic in small trials, different phases, was remarkably effective. And so we said, this could be really that antiviral we're looking for. And it also has numerous anti-inflammatory properties. And if you think about this disease, It's really two phases. The first phase is a viral syndrome, viral replicative phase, right? Where you have your typical cold or flu type symptoms. And then in a minority, what happens is the viral debris causes this intense reaction in the lung, and you go into a pulmonary phase, which is hyperinflammatory. Ivermectin has potent antiviral properties and potent anti-inflammatory properties. And Paul says it best. He's like, this is a gift to us. Like, this is the drug you would want to design to go after this disease. You'd want something which had those two sets of properties.
But the problem was the information about ivermectin was not getting out to the medical world.
And we realized that the traditional systems and channels of disseminating scientific knowledge was broken. The repurposed drug papers were not getting published.
Repurposed drugs are drugs that have already proven their safety and efficacy in humans for one disease and so are investigated as therapeutic drugs for a different disease. The problem is that repurposed drugs aren't sexy in the pharmaceutical industry.
The way the pharmaceutical industry works is one of the principles is they have to exterminate the use of repurposed drugs. And the reason why is that if you have an effective repurposed drug, it absolutely obliterates the market for your new, novel, very expensive therapeutics.
Typically, the patent for repurposed drugs are expired. Therefore, Big Pharma can't make monopoly-level profits on repurposed drugs. They are cheap generics that anyone can make. In other words, there is no incentive for Big Pharma to get behind ivermectin. But there was for Dr. Corey and his colleagues. They wanted to save lives. In October 2020, Dr. Corey decided to make some noise about ivermectin as a therapeutic for COVID-19.
And I wrote this really comprehensive review paper. It's antiviral properties, anti-inflammatory, prevention trials, early treatment trials, late treatment trials, even long COVID we know it's effective in.
On November 13th, 2020, they published the paper.
When I put it up, I was like shaking because I've never seen a therapeutic with this much consistent data. And I already started treating patients, and boy, was I seeing these incredible responses. And so I literally thought, like, our group may actually have contributed and identified the solution to this disease, the early treatment and prevention. And I really thought, like, this was an incredible moment in history.
But Dr. Corey and his team were about to experience something they never expected. They were about to see what it was like to face the big pharma beast. More of Red Pilled America after the break.
Amazon Health AI presents Painful Thoughts.
Why did I search the internet for answers to my cold sore problem? Now I'm stuck down a rabbit hole filled with images of alarmingly graphic sores in various stages of ooze. I can clear my search history, but I can never unsee that.
Don't go down the rabbit hole. Amazon Health AI gets you the right care fast. Healthcare just got less painful.
The Joel Osteen Daily Podcast.
God's plans for you are for good.
Be inspired.
Get ready. God is about to exceed your expectations.
Joel Osteen Daily Podcast.
You are coming out of that dry place into more than enough.
Daily encouragement right when you need it.
There are opportunities in your future bigger than you can imagine.
Listen to the Joel Osteen Daily Podcast on the iHeartRadio app, Apple Podcasts, or wherever you get your favorite podcasts.
Do you want to hear Red Pilled America stories ad-free? Then become a Backstage subscriber. Just log on to redpilledamerica.com and click Join in the top menu. Join today and help us save America one story at a time.
Welcome back to Red Pilled America. So on October 13th, 2020, Dr. Corey and his colleagues published a paper reviewing ivermectin as a therapeutic for COVID-19.
And so I literally thought, like, our group may actually have contributed and identified the solution to this disease, the early treatment and prevention.
But Dr. Corey and his team were about to experience something they never expected. They were about to see what it was like to face the big pharma beast. On December 8th, 2020, Dr. Corey was asked to testify before Congress on his ivermectin paper. He met the committee with the best of intentions. But when Democrat Senator Peters stepped to the microphone, he opened with a slanderous attack on Dr. Corey.
Last month, this committee held a hearing that was billed as a review of early outpatient treatments for coronavirus. Unfortunately, that hearing amplified unverified theories about treatments that are not supported by the scientific community. Sadly, it appears that today's hearing is going to follow the same path, playing politics with public health.
You know, the senator from my own party, because it was a Republican chairman, he essentially he walked out and dismissed us all as political, having political motivation.
The panelists have been selected for their political, not their medical views. And for that reason, the composition of the panel creates a false and terribly harmful impression of the scientific and medical consensus.
I used to be a Democrat. Now I don't have a home. I was so insulted and so angry. I don't know, it kind of just fired me up. And I gave apparently what was a very impassioned speech because it went viral.
I just want to start out. I didn't think I'd have to say this, but I want to register my offense at the ranking member's opening statement. I was discredited as a politician. I am a physician and a man of science. I have done nothing but commit myself to scientific truth and the care of patients. And to hear that I'm here because of a political angle, I am not a politician, I'm a physician.
And I was just I was just a ticked off doctor that day.
I want to start out by saying that I'm not speaking as an individual, I'm speaking on behalf of the organization that I'm a part of. We are a group of some of the most highly published physicians in the world. We came together early on in the pandemic, and all we have sought is to review the world's literature on every facet of this disease, trying to develop effective protocols. You just mentioned that I was here in May, and I recommended that it was critical that we use corticosteroids in this disease when all of the national and international healthcare organizations said we cannot use those. That turned out to be a life-saving recommendation. I am here again today with a new recommendation. In the last 9 months, in our review of all of the literature as a group, we have done nothing but try to figure out how to identify a repurposed and available drug to treat this illness. We have now come to the conclusion after 9 months, and I have to point out, I am severely troubled by the fact that the NIH, the FDA, and the CDC, I do not know of any task force that was assigned or compiled to review repurposed drugs in an attempt to treat this disease. Everything has been about novel and or expensive pharmaceutically engineered drugs, things like tocilizumab and remdesivir and monoclonal antibodies and vaccines. We have 100 years of medicine development. We are expert in all the medicines we use, and I do not know of a task force that has been focused on repurposed drugs. I will tell you that my group and our organization, I will say that we have filled that void. And I'm here to tell you, we have a solution to this crisis. There is a drug that is proving to be of miraculous impact. And when I say miracle, I do not use that term lightly. And I don't want to be sensationalized when I say that. That is a scientific recommendation based on mountains of data that has emerged in the last 3 months.
I don't know. I was just a ticked off doctor that day and and I was ripping because I knew we had a solution, and I couldn't believe that we were being ignored by our government and that no one was taking this seriously, and that there wasn't, an immediate systematic deployment of this medication.
Mountains of data have emerged from many centers and countries around the world showing the miraculous effectiveness of ivermectin. It basically obliterates transmission of this virus.
On one of the YouTube channels, it hit 8 million views in the US, but I know immediately, around the world, people copied that speech, translated, and it was all around the world in many, many different countries.
The big pharma response to Dr. Corey's testimony was bizarre. Merck, the company that invented ivermectin, began to question the drug's safety. In a February press release addressing studies on the drug's use for COVID-19, the company stated that there was, quote, a concerning lack of safety data in the majority of studies, end quote. It was an odd position, given their website boasts to having distributed 4 billion doses of ivermectin to humans since 1987 to eliminate river blindness. Why would they talk down the drug they created? Well, one reason could be that, as we mentioned earlier, the drug is now generic and can be made by anyone. But perhaps more importantly, Merck was paid $356 million in December 2020, the same month of Dr. Corey's testimony, to develop a new COVID-19 therapeutic.
It starts with all of the pharmaceutical companies that have a competing oral antiviral. Do you know how badly these guys want to have an effective oral antiviral that they can distribute to the country? A lofty goal for sure, but too bad we already got one. and they're very upset about this.
A few months later, in June 2021, Merck announced that the Biden administration agreed to pay Merck $1.2 billion if they could get a new COVID therapeutic oral drug approved by regulators. There is big money in new patented drugs, but not so much in generic repurposed ones. The attacks against ivermectin slowly started to trickle in. In March 2021, the FDA tweeted out, quote, "Some people are taking ivermectin, a drug often prescribed for animals, to try to prevent or treat COVID-19. FDA has not approved or authorized ivermectin for this use, and it can be dangerous for people," end quote. It was kind of a stunning tweet. The FDA knew full well that ivermectin received the Nobel Prize for use in humans, yet they still tried to tie it to veterinary use only. Dr. Corey shed some light on why an agency like the FDA would try to muddy the waters with ivermectin.
You don't understand. Those agencies are the pharmaceutical industry. There's a lot of really good people there, very smart, hardworking, great scientists, but that's not the voice that comes out the top.
As news began to emerge that India was using ivermectin to battle the coronavirus surge in May 2021, the attacks against ivermectin escalated. The chief scientist of the WHO, an Indian pediatrician named Soumya Swaminathan, tweeted out, quote, "WHO recommends against the use of ivermectin for COVID-19 except within clinical trials," end quote. The tweet triggered the Indian Bar Association to file a legal notice against the WHO and their chief scientist, accusing them of running a disinformation campaign against ivermectin and its safety and effectiveness in the treatment of COVID-19. The chief scientist would later delete her tweet. Slowly, the media and big tech began to join in. Just like China does around the anniversary of Tiananmen Square, big tech began censoring discussions of ivermectin. YouTube banned Dr. Corey's congressional testimony about the drug. The mainstream media would omit it when reporting Uttar Pradesh's success in fighting their COVID surge. And behind the scenes, the attacks were getting ready to escalate even further. And that's possibly because the opposition to ivermectin were tracking its prescription sales. The National Prescription Audit is a trade publication that tracks the sales of prescription drugs. They released data showing that over the 2020-2021 winter, as COVID cases increased, prescriptions of ivermectin increased as well. But then as the cases decreased, so did prescriptions of the repurposed drug. Again, Dr. Corey.
And then in the spring during the lull, it actually was slowly increasing even though cases were going down.
Meaning, even as COVID cases were decreasing, prescriptions of ivermectin were slowly increasing.
And we knew that is that people started to use it as a preventive agent because it's very effective. If you take it regularly, very few people get sick. And so people were starting to use it preventively.
But then as the summer COVID surge escalated in July and August 2021, the data showed that prescriptions for ivermectin skyrocketed. In a likely move to counter its growing use, the FDA tweeted out, quote, "You are not a horse. You are not a cow. Serious, y'all. Stop it," end quote. Another startling tweet from an agency that knew that ivermectin was a monumental drug for humans as well. But attacks went nuclear when popular podcaster Joe Rogan announced he had COVID and recovered quickly after using ivermectin, amongst other therapeutics.
So I got up in the morning, got tested, and turns out I got COVID. So we immediately threw the kitchen sink at it. All kinds of meds, monoclonal antibodies, ivermectin, Z-Pak, prednisone, and I also got an NAD drip and a vitamin drip, and I did that 3 days in a row. And so here we are on Wednesday, and I feel great. I really only had one bad day.
Joe Rogan's video triggered a massive anti-ivermectin campaign, a campaign that suggested the drug was purely used to deworm horses.
Rogan said he has taken several therapeutics to recover. One of those drugs he mentioned, ivermectin, is something more often used to deworm horses,
including the controversial horse dewormer that has poisoned hundreds of people nationwide.
They planted a couple of stories about animal, product overdoses in little papers, and then that started to carry.
Tonight we're hearing from a rural doctor treating Oklahoma patients who are overdosing on the drug meant for livestock.
Dr. Jason McEllier saying patients are packing southeastern Oklahoma emergency rooms, taking ivermectin doses meant for a full-sized horse, believing false claims it could fight COVID-19.
The ERs are so backed up that gunshot victims were having hard times getting to facilities where they could get definitive care and be treated.
The story was like chum for the media sharks. The Hill, Rolling Stone, the New York Daily News, the Daily Mail, the Guardian, and MSNBC's Rachel Maddow all ran with the story. The problem was the story was bogus. 2 Oklahoma hospitals issued statements denying they'd been overrun by ivermectin users. And the Oklahoma Center for Poison and Drug Information denied receiving any serious calls about ivermectin overdoses, and adding that if medical facilities had actually been backed up with overdoses, they would have heard about it, but they hadn't.
This thing about ivermectin, what I call Pharmageddon, that they unleashed on ivermectin in the last 3 weeks. It's literally at war against one of the world's safest drugs. And I just have to tell you, Patrick, I'm one of the world experts. It is literally the penicillin of COVID.
To be clear, the FDA has not approved ivermectin for use in treating COVID-19. But the National Institute of Health, or NIH, has now on its website a July-August 2021 study published in the American Journal of Therapeutics that concludes, quote, moderate certainty evidence finds that large reductions in COVID-19 deaths are possible using ivermectin. Using ivermectin early in the clinical course may reduce numbers progressing to severe disease. The apparent safety and low cost suggest that ivermectin is likely to have a significant impact on the SARS-CoV-2 pandemic globally, end quote. Red Pilled America actually spoke to someone that used ivermectin. Tyler Boyer is the COO of student organizing powerhouse Turning Point USA. In early September 2021, his wife caught COVID.
She got it first, and a few days later I was a pretty severe case of COVID.
He wasn't having breathing issues, but he was getting a gnarly fever spike.
And the weird part was that I didn't really feel like I had a fever. And then I took my temperature, and one of the first days I had I think it was a 105.3, which is obviously on the verge of absolutely needing to go to the hospital, and your organs starting to shut down and causing major issues. And so I immediately got on the regimen of fever reducers, going back and forth between Advil and Tylenol for every 3 hours, for the 2 pills. And that brought me down to about a 102. But I was a 102 to a 103 for I think I ended up being about 12 days.
But his fever wouldn't break.
So I was kind of freaking out, right? Because I was like, is this ever going to go away?
Now, Tyler works with the founder of Turning Point USA, Charlie Kirk, and they'd already discussed ivermectin on Charlie Kirk's podcast.
I wasn't trying to avoid taking ivermectin. I just feel like I'm pretty physically fit and I'm pretty young. And so, I was like, oh, you know what, this thing will break. And it didn't.
Tyler watched as his wife recovered in about 2.5 days.
And she's immune suppressed, right? Somehow I was impacted for whatever reason more. I got to that point and I was like, you know what, we have access to ivermectin. I'm going to get it.
So he made some calls.
I called a bunch of close friends that were doctors. Some of these guys, these doctors, support billionaires, and things like that. And so, I kind of trust these guys because I don't know if you noticed this, but not a lot of billionaires have died from COVID. And by the way, there's a lot of really rich guys in this world that they're taking ivermectin. They're doing Joe Rogan. Do you know how much money Joe Rogan has? He's worth hundreds of millions of dollars. Do you think that he has the best doctors? He probably does.
So Tyler's doctor started him on a treatment.
So I talked to these doctors, and the doctor said, why don't you try ivermectin in a Z-Pack? And so I took a regimen of ivermectin. I started a Z-Pack, and almost overnight, it was kind of just my fever broke and I was fine.
What Tyler took from this experience was that the centralized planning we're seeing in medicine, the same structures communists use, has a major flaw.
This is what's really scary is when you start thinking about all of the agencies, including the national science boards and foundations that exist, is that there's an element here where national scientists and national doctors don't want to be embarrassed, right? And so you have to accept that. You have to accept the fact that there's very few people making decisions at the top level.
Just like communism. Tyler actually lived 1.5 years in Russia and eventually studied communism in college.
The one thing that you learn coming out of looking at the Soviet experiment is that ultimately, at the end of the day, the people who are making decisions, there's very few of, right? And the very few have a massive amount of impact on millions and millions of people. And so when one guy makes a decision, if you think that that person isn't willing to do whatever it takes to support their decision, you're crazy.
Which leads us back to the question, what has COVID taught us about communism? COVID has taught us that communism f***ing sucks. COVID has been the Trojan horse to introduce a communist model in America. It started with authoritarian shutdowns, then doctors felt it on the front lines. In some cases, this new top-down model removed their ability to do what doctors have been doing since the beginning of modern medicine, which is to care for their patients in the way that they see fit. This communistic model spread to managing our behavior. Then, like China does for Tiananmen Square, big tech wiped unauthorized speech off their platforms, because communism and free speech don't mix. What COVID has taught us is that communism and the American way of life cannot coexist. Central planning kills.
You got to trust somebody that's local, that you've known forever, that you know it's not going to screw you. You and I don't know any of these people. And we're going to put our lives in their hands. It's anti-American, in my opinion.
The entire ordeal has affected Dr. Corey deeply.
I'm a changed man. The things that I've learned, that I've seen, the distortion of science, these phenomenal powers of financial interest to dictate the running of this pandemic is just been frightening.
But even with this new communist-style censorship, Dr. Corey and his colleagues have continued to push their message of hope out to the public.
The final message I want to say is this is an immensely treatable disease. It is a severe viral syndrome. When treated early, almost everyone recovers. And so that is the big message.
Always consult your doctor before taking any medication. To learn more about Dr. Pierre Corey's COVID-19 treatment protocol, visit his group's website, flccc.net. And be sure to follow Tyler Boyer doing God's work at Turning Point USA. That's tpusa.com. Red Pilled America is an iHeartRadio original podcast. It's produced by me, Adriana Cortez, and Patrick Corelchi for Informed Ventures. Now, our entire archive of episodes is only available to our Backstage subscribers. To subscribe, visit redpilledamerica.com and click support in the top menu. Thanks for listening.
What God started in my life, He's going to finish.
The Joel Osteen Daily Podcast.
Surely goodness and mercy will follow me all the days of my life. What was meant for my harm, Lord, I want to thank you right now. You're turning to my advantage.
Your daily source of hope and encouragement.
Your second wind is on its way. God is about to breathe on your life in a new way.
Listen to the Joel Osteen Daily Podcast on the iHeartRadio app, Apple Podcasts, and wherever you get your favorite podcasts.